In this video, we'll discuss the top 3 things that I, as an ophthalmologist, would never do. First, go into the sun without sunglasses. The sun's UV rays can cause serious eye disease, including cataracts and macular degeneration. In fact, a study by the World Health Organization shows that up to 20% of cataracts worldwide are directly attributable to excessive UV exposure. Wearing sunglasses with 100% UV protection is crucial to block these rays and protect the eyes from long-term damage. Besides the eyes themselves, the skin around the eyes is very susceptible to UV-induced damage, including skin cancer. The skin is in this area particularly thin and sensitive, which is why dermatologists and ophthalmologists recommend wearing sunglasses to reduce the risk of skin cancer. Studies have shown that certain areas around the eyes, such as the eyelids, are particularly prone to skin cancer, accounting for up to 10% of all facial skin cancers, according to data from Skin Cancer Foundation. Lastly, I want to mention the so-called surface eye, or medically pterygium. This is a growth that often develops on the surface of the eye and can be exacerbated by UV rays. Pterygium can lead to irritation and vision problems, and sometimes even require surgical removal. According to a study published in the American Journal of Ophthalmology, regularly wearing UV protective sunglasses can significantly reduce risk of developing a pterygium. So let us see what this is like. So pterygium, you have got basically the issue that our conjunctiva, you see here, this is like the white area of the eye, it gets excessive tissue. And this excessive tissue can grow over your cornea, maybe even into your visual axis, so which will significantly reduce your vision. What we will do in such a situation is basically I would go with an instrument below this excessive tissue, so basically like here below this area, and I would cut it out basically from the cornea, make an incision also here in this area, takes this off completely, and then comes the beautiful part. You have to do a conjunctival transplant. So basically what I have to do is take a part of the conjunctiva here in the upper lid, most of the time below the upper lid, so no one can see it. And you take this transplant and put it here. And the reason for this is, this way you have got a lower risk to get another pterygium in the future. So it's a very important step and makes the surgery a bit more complex, but it has got like a significant effect and a significant improvement if you do it then compared to not doing this step. So I would definitely recommend it. In summary, wearing sunglasses is simply yet effective measure to protect both the eyes and the surrounding skin. It is not just about looking good, but about safeguarding your eyes from serious damage. So remember to always have sunglasses with you when you go outside, especially now as the sun gets stronger. By the way, there is also a big difference between sunglasses with polarized filters and those without. We'll be making a video about this soon. Now let's move on to point number 2, skipping eye breaks during screen work. Digital eye strain, also known as computer vision syndrome, affects an estimated 50 to 90% of people who regularly use computers and other screens like your mobile phones. Symptoms include dry eyes, fatigue, blurred vision, and headaches. These complaints arise from staring at the screen for extended periods, which leads to reduced blink frequency and excessively strains the eyes. A very effective method to combat these symptoms is the 20-20-20 rule, widely recommended by ophthalmologists. The rule states that you should take a break every 20 minutes for at least 20 seconds while looking at an object about 20 feet away. This technique helps relax the eye muscles and reduce symptoms of eye strain. Research results from the University of Melbourne show that people who take regular screen breaks report less eye strain and higher productivity. Long-term effects of too much screen time without adequate breaks can be serious. Studies such as the one published in the American Journal of Ophthalmology have found a connection between increased screen time and the increase in myopia in children and adolescents. This condition develops when the eyes focus on close distance for long periods of time without sufficient breaks for distance vision. So what I would definitely recommend you, if you have children, first of all, try to put the screen as far away as possible. And second of all, let them be outside as much as possible, because there are studies which have shown that if the children are playing outside and basically they get sunlight, the sunlight protects the eye from growing. And when it grows less, you have got a lower risk of short-sightedness. So it's very important that your children, as much as possible, are outside and put the tablet or the screens as far away as possible from their eyes, so they've got a lower risk for nearsightedness. In conclusion, Taking regular eye breaks while working on screens not only relieves short-term eye strain symptoms, but also provides long-term eye health benefits. Therefore, it is important to consciously take breaks and prioritize our eye health. Number 3, excessive eye rubbing. While rubbing your eyes can provide short-term relief, especially if they are itchy and irritated, it can have serious long-term consequences for your eye health. One of the most serious potential consequences of eye rubbing is the development of a disease called keratoconus. This condition causes the cornea, the clear outer layer of the eye, to get thin and bulge outward in a cone shape, causing significant vision loss. Research shows that keratoconus is significantly associated with repeated vigorous eye rubbing. A study published in the Journal of Ophthalmology identifies eye rubbing as one of the leading risk factors for developing a keratoconus. I want to show you what this disease is about. So usually how our cornea is shaped is we have got such a shape, okay? So you see it's quite regular. And what happens with keratoconus is basically it is more cone-shaped, you see? So it gets developed more in the front. And this causes an increase in the refractive power of the cornea and will reduce your vision. So it's very important to reduce the eye rubbing, because what the eye rubbing actually does to your cornea is your collagen fibers, they get put together away, and when they get away from each other, basically the cornea can get more and more cone-shaped, and this will increase the refractive power and decrease your vision. So try not to do it. In addition, rubbing the eyes can cause microtrauma to the cornea. This increases the risk of infections because the small cracks allow bacteria and viruses to enter the eye more easily. Research published in the Journal of Cornea confirms that microtrauma caused by rubbing the eye can increase susceptibility to infectious keratitis. Another important aspect is the potential for worsening of existing eye diseases. For people who suffer from glaucoma or advanced diabetic retinopathy, rubbing the eyes can temporarily increase intraocular pressure, which can worsen existing conditions and lead to further vision impairment. According to the American Academy of Ophthalmology, this is particularly problematic and can cause irreversible damage. So in summary, even if it's difficult, especially if the eyes are tired or irritated, it is important to resort to gentler methods of relief, such as using moisturizing eye drops or closing your eyes for a few minutes instead of rubbing them. I've got another tip for you which you can do. Basically, if you feel the urge to rub your eyes, what you can do is push on your bones in the middle area of your nose. So basically here, try to push and rub a bit like in this area. This will usually have got the same effect as if you would rub your eyes directly, but has got causes much less damage to your cornea. Especially this is recommended to people who are after laser surgery. So there I would definitely tell you, please try to avoid rubbing your eyes after laser surgery. Rather push gently here on your bone, which will help you to relieve this urge to rub your eyes. I hope this video helped you. If there are further comments, we are happy to hear. Okay, das letzte Stück rausmachen.